So you see again now, you see the difference there now? You see how that has the convexity towards the brain substance? Yeah. So this one is now this is subdural, right? Yeah, you see it now? It has a, yeah, you agree? So it's always, that's a hint for you. One, or you can use the word lenticular form. The other one is lemon shape, or people will call this a banana shape. Yeah, but it varies, whatever word you use to describe it. Yeah. But this one is convexity towards the brain, concavity towards the brain, right? And again, query, look and see. You see what's happening? You see there's also some shift. You saw the ventricle there is narrowed as well. There you go. So you expect that, right? So you're going to get the same signs again, because it's the same principles. Yeah. But subdural, what type of bleeding this is now? Venous. Always remember that. Again, MCQ group. So remember that. So epidural, the bleeding is arterial. Subdural, the bleeding is venous. All right. So you can see right away that this is not going to be as rapidly in development as, say, artery, epidural. Yeah. But the principles are going to be the same, really. Yeah. The difference now is whereas epidural. I mean, remember nothing is ever absolute as I begin to teach you in medicine. Yeah. But remember, we are dealing with common things at your level. So remember, epidurals are common in younger, fitter people who will ride motorcycles and so forth. Subdurals tend to occur in people like me who begin to get what? Atrophy of the brain. So you get gaps between the brain and the meninges. So you see how those vessels will tear, the veins will tear easier. Yeah. So that's an MCQ question as well. This subdurals tend to occur in older people. Epidurals tend to occur in younger people. Remember, don't say that epidurals don't occur in old people or subdurals don't occur in young people, right? But just remember that principle. All right. And the principles are going to be the same. As I said, the signs will be similar because of the pressure effect. In fact, when you maybe come back next week once you get it all together, I can put it together better for you. Where we talk about local things and general things and things that happen to the brain. You can talk it much more crisply, right? But basically, they all have the features of a epidural and the subdural going to be the same, except for, I heard someone mention earlier, the lucid interval. Yeah, the lucid interval is more commonly seen with patients who have a epidural. Yeah, is it because remember that, as we just said, yeah, the bleeding is going to be more quickly, as a subdural will go on for days and days and days. Epidural tends to develop much quicker because it's arterial. Yeah. So you can see the patient comes first, and as Query said, they might be talking to you very nicely because they might be stunned when the accident happened, and that's when they might be unconscious, and then they come into you and they're conscious. But then as it develops, the epidural develops, there you can see they will begin to lose consciousness. So it's the correct way. Alright. Okay. And you do the same thing again. Yeah. Intracerebral bleedings tend to be much more associated with NCDs. Yeah. And remember, again, the features might be the same thing, but again, whereas you will see epidurals and subdurals tend to give you the hemiplegic type symptoms. Patients who have intracerebral bleeding into the brain substance now tend to get isolated things, like they might get aphasia. Yeah. Or yeah. You see the difference? Whereas the patient who have an epidural or subdural will get hemiplegic symptoms. The eye symptoms we talk about, the patient who have the intracerebral will get more of the functional things, the loss that you get. Yeah. Okay. You see an intracerebral one there. Intracerebral. Yes, skull fractures. Skull fracture. You see the bleeding underneath. Fractures, neck fractures. Right. I think we'll leave these back for next year, maybe. Yeah. Then you have a little bit more understanding. Nobody will, unlikely you'll get this in your exam next week. Yeah, but you did work for it because you need to know what is spinal shock and so forth. Now you know it's finished, so you can determine whether you'll come to vision. We'll leave that for next year.